growing, but there are some situations where we find people who present with advanced cancer. It's already metastasized, and there's really not much you can do. So it's really frustrating for us to see that. And we always say this could have been prevented by a blood test. Just once a year, a blood test could have prevented a lot of these.
Hello, everybody. Josh Rubenstein, Kaiser Permanente, Southern California Media Director, and welcome to KP Candid Conversations. These are frank, honest conversations about your health. And today, we're talking about men's health. A Cleveland Clinic study found that 3 out of 5 men never go and get their annual physical. Same study, 40% only go to the doctor if they think something is seriously wrong with them. And then the last stat, which I think is interesting, half of the men don't even want to talk about their health. They don't feel comfortable talking about their health. To help us make sense of all of this is Dr. Reza Gohar from our South Bay Medical Center. Dr. Gohar, tell me this. What is it that men get wrong when it comes to their own health?
Absolutely. So I think in general, I would say a lot of men feel that they're very busy and taking care of their health may not be their highest priority. It's not always a high priority for them, and therefore they try to avoid going to a doctor or asking for help. Now, there are different situations, and I can give you examples of that. There are some men who are younger, healthier, they feel they're in good shape, and they don't really need to see anyone because there's really nothing wrong. They have no symptoms. And I think that's one group, and the other group is men who have symptoms, but somehow they feel that they can figure it out, and they go online to look for answers. They hope the issue will resolve, and sometimes it does, but other times it doesn't. And what generally happens is by the time we see them, there's that delay that's making a big change in the treatment plan. Now, as far as examples go, I would say for, again, younger adults or anyone actually, it doesn't have to be age related, know your family history. And many times you may have no symptoms, but if you have diabetes, if you have heart disease, if you have blood pressure issues, the chances are that you're at risk for getting some of those things eventually at some point in your life. And it's always good to recognize that and be aware. Now, healthy lifestyle is great. We can always do that, but it's always good to get checked. Maybe periodically check your cholesterol level, check your sugar levels, check your blood pressure. Just simple things that doesn't take a lot of time, but you can at least learn about how your body's doing instead of waiting for something to happen to you later in life. And for some men, I would say if you're 50 years and older, 50 to 70 years of age, perhaps, would be to check for prostate cancer. A lot of times people don't realize prostate cancer has no symptoms until it's very late stages of cancer. And if you wait for that to happen, it may be too late to deal with it. So what I would say is ask your doctor for a blood test, PSA, once a year. That's really the least you can do to take care of that issue. It's the second most common cancer in men after skin cancer, and it doesn't really cause any symptoms until it's really advanced. So it's really good to get that checked. As far as symptoms go, men who have symptoms, they might feel a lump or growth, or they may see blood in their urine or some other symptoms. And I think what happens typically is people like to procrastinate, and they just hope it goes away. They can figure it out, and they go online, they look at all the things they can find. Sometimes it does go away, and that does happen, but there are other times that it just doesn't. And delaying asking for help, I think sometimes can again be a big difference between a simple answer to a problem or a complex solution. So I would say just be aware of your health, take care of yourself, and don't wait for things to happen, and just be smart about it.
It's got to be frustrating for you as a physician, knowing that there are so many of these, problems. You have patients who may come in who are advanced in some of these issues that really could have been, at least cut off at the pass, so to speak,
Right.
if there had been some regular screening.
Absolutely. I give you a good example. The prostate cancer is the one that we see commonly. What ends up happening is some men just are not even looking at it seriously, or they may be aware of it, but they just don't have the time for it. And they say, "I'll do it later," and that later may be years later. And then by the time we see men with prostate cancer, most cancers are treatable and slow growing, but there are some situations where we find people who present with advanced cancer. It's already metastasized, and there's really not much you can do. So it's really frustrating for us to see that. And we always say this could have been prevented by a blood test. Just once a year, a blood test could have prevented a lot of these. And I think a lot of men may not be aware of it, or they're just too busy to make time for it.
And I'm going to ask you, as a generalization, is it true that men generally don't do well when it comes to regular checkups, being very proactive about their health? Is that kind of a good general statement?
Um, I I would say typically men don't ask for help right away, per se. I would say the doctor visits are lower with men compared to women, and a lot of men uh, want to deal with this on their own and figure it out, and they don't always um, need to come in, but so they feel like if they can search it online and ask their friends, the problem may just go away. But that's where it gets a little bit dangerous, because things do go away, as I said earlier, but there are other things that don't, and then there's that fear that there's something wrong, and that delays things even further because they don't want to find out. So yeah, there is some delay in care. There is some lower frequency of doctor visits. Just it's just not high on their priority list.
Yeah. You mentioned a couple times, and I just want to, we've all done it. We've all gone to Google when something felt wrong, or we were thinking about something, or even heard about it on TV, maybe.
Yes.
Tell me what you, as as a trusted physician, what's your take on people that go and trying to diagnose themselves?
I would actually encourage men to learn about their condition. I don't think there's anything wrong to learn more about it. And I think the information a lot of times may add to their understanding of the issue. My advice is just be mindful of the source you're looking at. Just make sure this is a reliable source. And there's a lot of great information. There's also misinformation. And I think it's good to go through that. And then at the same time, ask for a consultant, ask for help, talk to an expert. I think the combination probably would work really well, because by the time we see them, I think that they come in with a lot of knowledge, and I think that's really important. There are times that I feel the online information gives them a better understanding of why we're recommending certain things, and I think it just reinforces that. But again, just be careful with your source, and still ask for help. I think the online um, information is not a substitute for expert advice, so I would actually recommend both in parallel.
Let me ask you this, doctor. Why did you get into this particular field? Well, you specialize in
Yeah,
urological health.
yeah.
Tell me what inspired you to go this direction.
I actually love it because there's so much variety for me. There's a lot of chronic conditions we see. So when we see patients, we don't just see them for one or two visits. We actually see them for lifetime. There's conditions that we see them for prostate issues, sexual issues, kidney stones, urinary issues. So that part of it is very appealing, that you have that bonding with the patient and you can see them for a number of years, if not many years. There's a lot of surgical procedures we do. There's a lot of variety in that. And it's very satisfying. I feel that when I go home every day, when I did my rotation, I felt like this was such a great specialty for me. I felt so much joy. And when you do stuff that make a big difference in people's life, whether it's prevention or whether it's treatment, I think it's very satisfactory. So there's a lot of different things you do, and for me, uh, the fun part, the best part is prevention. I'm a big advocate of prevention and not treatment, because if you can prevent things in advance, you can avoid things, or if things happen, we all get older and we have things happening to us as we get older. So at least you're going into it healthier, you're going into it at the earlier stage. So I really enjoy it. When I go to work, I'm really enjoying it. It gives me a purpose, and when I go home, I feel very satisfied.
Let's start as far as prevented. I want to go through some preventative tips
Yeah.
and some things to look for if there are problems. So let's start off with ages. When should I start checking myself, appropriately? Is a regular yearly checkup? Is there something I should do when I'm 30, 40, 50?
Yeah, I would say always know your family history, because some of us have different conditions in our family. As I said earlier, there's a really good chance that you're at risk for some of those conditions. So if that's the case, I would start at a younger age, maybe in your early 20s. Just be aware of what's happening around you and your family, and then some of the things you can do to prevent it. And I don't necessarily feel that you have to see a doctor every year at that time in your life. As long as you take care of yourself, I encourage people to adopt a healthy lifestyle, great nutrition, physical activity, mental and emotional wellness. There's all those things you can do for yourself that really is helpful. And I tell people, do it in small steps and build on it. You're going to feel so much better after a couple of months of doing it. So initially, just if you do that when you're in your early 20s, it just gives you a good understanding of your health, what could happen to you, and how you could prevent things. And then if you generally feel good about yourself and you're having a good lifestyle in terms of exercise, nutrition, and emotional wellness, I think you can do that every few years, even every 5 years, every 10 years. As you get older, your risk of developing chronic conditions and some of the other conditions are higher. So more frequent, again, checkups. We do the same thing, by the way, for our car. When
Mhm.
we own a car, we take care of it. And I think people should be their own advocates. That we get one body and we have to take the best care of it. So not only we live longer, but we also enjoy great quality of life. I think those are the benefits that we all see once you take care of yourself.
And then what about things that I should be looking for? Some signs and symptoms that are red flags and concerns.
Absolutely. So obviously anything that's unusual, anything that just doesn't feel right, like for example, if you see blood in your urine, that's not normal. So something like that, you should talk to someone about it. If you notice a lump or bump on your body and you're just not sure why you have it, and I think those are things you should at least talk to someone. Many times, the answer may not be anything scary or bad, but at least you have it looked at, and it gives you comfort that everything's okay. And if there is something abnormal, then you deal with it at the earlier stage. In For men in urology, we see men who have urinary symptoms, frequent urination, slow urine flow, and some of those could be a sign of an enlarged prostate or an overactive bladder. And I think if you address them at the earlier stage and go and get it checked, it would be so much easier to resolve it than waiting for something to happen later in life. So these are just some examples, but again, anything that just doesn't feel right and it's really just doesn't feel good, you're having a pain that you haven't experienced before, or you're feeling something on your body, it's good to have it checked.
Well, and Dr. Gohar, in your long career as a physician, we've come so far, haven't we? Like some of these conditions that, we really do have therapies and potential cures for, correct?
Absolutely. There are so many things on cancer care, preventing things and discovering things at the early stage. I would say a PSA test for prostate cancer screening, colonoscopy for colon cancer screening, and then there's other things that we can actually prevent. Uh, I give you a good example. Kidney stone is a very common condition. 1 in 10 or 11 people will have a kidney stone in their life, so it's very common. And we know that people who have a kidney stone will keep having recurrent kidney stones. So it's a chronic condition with high rate of recurrence. And most people may not realize it's very preventable. And we can actually, if you have a kidney stone, for example, we can do a urine test, and we can give you some dietary advice, and we can analyze the urine and tell you why you're making kidney stone. And I would say 80% of the time, you can prevent future kidney stones. So that's just an example of something that we see a lot in the emergency room. We see a lot of people who need surgery for it, but if you prevent it, if you do the test and just follow through with the recommendations, many times you can avoid a complex surgery or just a lot of treatments that may affect your quality of life.
Excellent. Dr. Reza Gohar from our South Bay Medical Center. Thank you so much. These are great advice for us. Great advice for men everywhere.
Thank you so much for having me. It's a pleasure being here.